All right, everybody, it is a new year and certainly new challenges face our tightly knit island community. But one agency that continues the mission and the fight for good health and taking care of our people is the Guam Memorial Hospital. And I have the esteemed pleasure of being joined by a dear friend of ours, Lillian Perez-Posadas. She is the administrator and CEO of GMH. Auntie Lillian, buenas and Happy New Year to you and the team over there.
Buenas, Jason, and Happy New Year to you and the team also with KUAM and the people of Guam. Thank you for
Absolutely.
this opportunity.
Well, I got to say, I mean, your experience in healthcare goes back far, but that $1 million smile and everything like that is certainly very welcome bedside manner to not only us in the media, but certainly to the team at GMH and to patients, I'm sure.
Well, we have to. We want to make sure that our role is to help people feel better and get well.
Exactly. And I think part of that is what we're talking about today, because Lillian, there's always been such a natural marriage in the practice of medicine with any sort of technology. And telemedicine is something that with your own experience, you have always pushed for. And I remember back in 2021, there were some innovations made at GMH with bringing in different physicians by way of video. And you've actually hired two neonatologists recently that will provide services, consultation services via telemedicine, right?
Correct. Yeah, we started out, this is one of the blessings of COVID. We went into telemedicine. Telemedicine and telehealth have been in existence in our healthcare system.
Mhm.
But, COVID really highlighted it because of the distance that we had to keep and, isolation. And so in 2020, when we were challenged with having critical care doctors, intensivists on the ground, and so we were very fortunate that a doctor in the mainland offered telehealth, telemedicine opportunity for us. And so we worked with Dr. Darren Summers and helped us through the COVID, through the telemedicine capability. And then we have branched off to then get neonatologists. We hired one in 2021 through telemedicine. And just in August, recently, we had another neonatologist join us. And so we have 24/7 coverage for the neonate population. And so that has worked out very well because then they collaborate and they work with the pediatricians who are boots on the ground here in the hospital. And so through the telemedicine, the consultation is available 24/7. They use an equipment called tele-rounder. And this is an equipment that is at the bedside with the pediatrician and the nurses. And it does have equipment that can listen to the neonate's lungs, take a look at the neonate's physical condition. And through that, with the physician on boots on the ground, they then confer and discuss what then is the diagnosis of the infant or the neonate and what the treatment plan going forward for that neonate. So it really has worked out very well.
Yeah, so even though the physician may not be physically present and examining the patient as is traditionally done, they can still get real-time data about diagnostics and the information that they need to make proper diagnoses.
Absolutely. And physical examination, listening to the heart sounds and the lungs and, all of that. They can do some of that physical examination through this equipment called Rounder. And with the doctor, pediatrician at the bedside can say that, yes, that is correct. That what you're hearing is what I also hear in terms of the heart sounds, the lung sounds, and, that it really has worked out very well. And the parents I hear are very, very happy with this capacity that we brought on board, working with the pediatrician who is on site.
I was just about to ask you that. So, what has the feedback been from the patients that receive care in this format?
Yeah, because these are neonates, it's really the parents that then can speak on behalf of their infant, and so they're very pleased. Yes, they're very pleased and very happy.
And Auntie Lillian, would this possibly be an indication of further services that the hospital may be looking into or already is in the pipeline of implementing for things, because you've also hired two OBGYNs and applying this kind of new medical services to local patients and everything like that. Do you see other types of medical practices being applied?
Yes, and absolutely. Already in the pipeline and on the docket, we're looking to bring on board through telemedicine a physician who specializes in rheumatology, in also more pediatricians. Right, having it available, and also more pediatricians who we can then connect and be available for the pediatricians who are here in person, and also additional cardiologists. Again, we're looking to bring on board a neurologist. We just secured a physician who's got neurology specialty. And, again, we brought on more intensivists. So yes, we like to branch into other specialties. And so this will just, again, enhance and really expand our services here in the hospital.
Well,
and that's what we want to do.
I'm sure that rheumatologist may not realize how much work they've got cut out for them. But I mean, with the amount of cases of gout we've got on the island and everything, that person's probably going to have a lot of cases to tend to, and to the benefit of our community.
Yes, absolutely.
Okay, so to wrap up and everything, what does this mean for GMH's ongoing, commitment to, not just to like see a patient and say, we'll get you well and we'll get you on your way and everything, but to provide, that full service line of care?
Well, again, it means that we will continue to then get the CMS certification, providing the care, the quality of care, and the excellent care with a broader range of services that we can do. Maternal child health services, we are the only ones here in Guam that provides the services, the maternal child health population. The cardiology, again, we are the only act in town that can do cardiac catheterization, cardiac stenting. And so we want to expand it to make it available more days instead of just limiting it to certain days throughout the week. So we want to continue to provide it on a more frequent basis. And so, yes, it means that, the services for the people of Guam will be here, and hopefully they don't need to go off island.
Sure. And before I let you go, I just thought that logistically, this is probably easier than, going through the whole, and, you've got a background in, working with the airlines and, provide, like doing the logistics for that, but, bringing in physicians and getting them on a contract and relocating them, you can just kind of like, maybe just like, almost like, I don't want to equate them to movable parts, but, switch out and get, proper physicians directly seeing patients faster this way, telemedicine.
Absolutely. Yes.
Okay. All right. So that's Lillian Perez-Posadas, of course, doing a fantastic job at Guam's only public hospital and maintaining that level of care. So once again, Auntie Lillian, Happy New Year to you and your staff over there. And we really, really look forward to covering you for GMH Week.
Yes, absolutely. That's coming up pretty fast too. So thank you, Jason. Thank you for this opportunity.
I'll be talking to you for that.
Okay. Happy New Year. All right.
Happy New Year to you too. Take care.
Take care. Bye-bye.